Okay, so we're going to go ahead and get started. My name is Jim McCaffrey, and I've been working in the health and social service workforce strengthening field for a number of years. And to my left is Daniela. It's Legiri. I'm sure I butchered that, and Linda Rawlings to my further left. And I think somebody mentioned this earlier, but just so you kind of remember that in your packet, there's a more complete bio of all the people that have spoken today and that are kind of involved with this. So I think today has been, for me, it's been inspirational to hear, especially the three specific sort of experiences from the country level, from Uganda, from Scotland, from the Philippines, but also even around the tables at lunch from some of the specific examples, to see the kind of richness of experiences, the richness of research, the richness of what is going on. And that's a good backdrop for this particular session, which is to take a look at a call to action and about how a stronger workforce can make progress in helping to meet the SDGs. And I wanted to link it in particular to a couple things that I heard this morning. From Dr. Gordon, she had some real good examples that she was using around individual interventions to help kind of children in need. But then made the very important point that in the long run, it's a sustained support system that will help these individuals kind of retain the kind of support they need. And that's, again, one of the things we're talking about. What is the support system that will help the workforce, not just in a one-time intervention, but over time? And then the second one was the graphic from the Scotland presentation. Around you can have research over here and practices over here, but one doesn't always lead to the other or inform the other unless you have, I think the terms they were using was this sort of science of science and practice of interventions. And I think that's so important around if we're trying to look at actions that will be continued over time, that you have some kind of knowledge sharing around what practices work, and not individual practices, because I think that was a really important point, that a particular training program or a counseling program or a supervision program by itself doesn't necessarily lead to change. It's some kind of a thing that combines all this into a thoughtful intervention process. And that, as a sort of background, as an alliance, we thought that was an appropriate contribution we could make in addition to knowledge sharing and convening, and it was the idea of having a call to action that we could use at a global level and that people could use at the country level to help them advocate, which is the third thing the Alliance does, for funding and leadership at the country level that would allow kind of progress to be made in strengthening the social service workforce to provide the services that are needed to be provided. So that's a kind of a little bit of background about this session in terms of a call to action. And then we wanted to just share some ideas and examples about from our panelists about how they think a kind of stronger workforce would contribute to meeting the SDGs. And then we have some more specific questions after that. So that's the question I'm going to start with. We're going to do this a little differently. I'll ask some questions here and there that they can respond to, and then we'll open it up. And I should say there was Wanda Jaskowicz was supposed to be here today to talk a little bit from the health perspective, health workforce perspective, but she's under the weather and couldn't make it. Since I've done quite a bit of work in that area, I'll provide a few comments a little bit later about that. So why don't we start with either one of you around what your perspective is about how a stronger workforce could help move towards the SDGs.
We'll go this way first. Well, first of all, thanks so much. This has been fascinating. I appreciate being here. Again, my name is Daniela Ligero, and I am the CEO of Together for Girls. I'll tell you just a little bit about my organization before I answer that question, just for context, because I think a lot of you don't know about us. We're often behind the scenes. We are a public-private partnership that was established about 9 years ago, focused on ending violence against children. The name says girls, but we have since evolved to focus also on boys, and we're much broader than just girls. And the way our partnership works is, and the reason it was started is because we were trying to answer a lot of the challenges we heard about today. Multiple sectors, multiple actors, each doing their own thing, no alignment, no coordination. So the idea was, well, what if we had a platform? And remember, this was 10 years ago when there were not a lot of partnerships doing this, where we could bring together the UN. So we have 6 UN agencies that are partners, including UNICEF, governments, private sector, everyone, civil society coming together to tackle this issue of violence against children. And the founding members were the US government, PEPFAR, Gretchen is sitting here, she was there from the beginning, the Canadian government, CDC, as well as now over 20 national governments from around the world where we're active. And our model is pretty straightforward. It always starts with evidence. You've heard a lot about VAX, the Violence Against Children surveys. Those are led by governments with CDC support, UNICEF support, PEPFAR support, as part of our partnership. And today, it's been fantastic to watch over the last 10 years where there was practically no national level data on this issue. Now we have data for about 10% of the world's children and adolescents, and there are an additional 10 VACs happening over the next 2 years. So it's so exciting to see that the database is growing. And what our partnership tries to do is first start with a survey, and then use those data to really help coordinate a multi-sectoral approach to response. And you heard about how that's working in Uganda, how that's working in the Philippines. There are examples from several other countries where the national government is leading this process, but you're trying to bring all of these different actors together to really respond to these data. Now, I tell you all this because I think one of the really exciting things that's happened in the last 10 years is, of course, the SDGs, and the fact that violence has been prioritized across multiple goals. With the MDGs, we didn't have that. And what this allows us, though, to have, and I always think, people think of the SDGs as, some big lofty thing that's far out. And at the end of the day, it's a political tool. And unless we're able to transform what was agreed to up here to a country level and use that as political leverage to move the agenda, it's not really very useful. And so at the end of the day, what the SDGs do is they say, okay, 193 countries said, this is where we want to be by this period in time. These are the things we want to achieve. So the political leveraging is how do you take that at a country level and say, okay, you've said this is where you want to go. Now let's help think about how we're going to get there. And that's where I think there is such an opportunity for the social workforce to say we have a role in helping to get there, not just for 16.2, which is ending violence against children, but so many of these targets, so many of these goals. And so that conversation, I think, is sometimes challenging, but that's the opportunity I think that the SDGs offer for us to try to move from the international to the local, and using political moments. I mean, I hope everyone is aware that next week in July is the high-level political forum in New York, where heads of state will come together to evaluate and look at their progress on a few SDGs. And in July of next year is 16.2. It's 16, but that includes 16.2, violence against children. So here is an opportunity for us to think about how do we leverage that moment to figure out what countries are doing. So those are just some thoughts.
Great. Thank you, Jim. Thank you, Danielle. It's a pleasure to be here. I'm Laura Rawlings. I'm a lead social protection specialist at the World Bank and part of the leadership team in our Investing in the Early Years flagship initiative. And I'll talk a little bit more about that in a minute, but just wanted to share a few thoughts with all of you. First of all, to congratulate you on this important work because the initiative around the Workforce Alliance is extremely important, and to relate that just to the question in the MDGs, I think is worth reflecting on. as Daniela was saying, it's very much a political tool to have the SDGs, and then it speaks to a mantra that I think is always sort of clever and useful, which is that you measure what you treasure, right? And so the fact that we have, as a global community, outlined these 17 goals, that we have put metrics behind it, that we are holding ourselves accountable to progress is really important. And just to touch on some of them where this workforce is so important in the social service sector and working with children, let me just mention 5 of them. So the first one, the first goal around ending poverty and target 1.2 is reducing by half the proportion of men, women, and children of all ages living in poverty. So here, obviously, the role of the social service workforce, particularly those that are working on poverty-targeted programs with specific vulnerable populations, so social protection programs, social cash transfers, those areas, this is very important. And increasingly, what we're seeing is that it's not only about income support and risk management, there's also very much of an encouragement to look at multidimensional elements of poverty and to use poverty reduction programs to invest in human capital, to invest in productivity and productive inclusion, and these are very important dimensions. Very closely related is Goal 2 and Target 2.2 about ending hunger. Consumption-based poverty is obviously all about hunger and is very closely related, but also has a lot to do with nutrition, which we know is about more than just food, right? Goal 3, Target 3.2, to end preventable deaths of newborns and children under 5 years of age is extremely important because it speaks to the whole maternal and child health agenda, and we know that much of the frontline workforce working with pregnant women and young children and adolescents is very important to looking at those preventable deaths and even beyond the mortality issue, the morbidity issue. So the whole sort of Alive and Thrive agenda that you want to ensure that that maternal and child health is very much of a priority. The last 2 I want to mention, Goal 4 and Target 4.2, ensuring that all girls and boys have access to quality early childhood development, care, and pre-primary education. So this recognizes the importance, and I like it not only of childcare and access to preschool and that pre-primary education, but very importantly, the whole element that I think is captured very well in the nurturing care framework that came out of a lot of the work in the Lancet, where you really need responsive caregiving and you need to be working with families, with parents, and with caregivers to start to invest very early in the health and development and cognitive stimulation of children. And then just so you know that I haven't forgotten it, the last one, last but certainly not least, is the one that Daniela mentioned, Goal 16 and Target 16.2, to end abuse, exploitation, trafficking, and all forms of violence and torture of children. So that, very importantly, it's your field, so you'll speak more about it, but there clearly the service workforce has a very important role to play. And in all of these areas, I think it's important to recognize the emphasis on behavior change and the role that the people who are really on the front line of interfacing with families, of interfacing with caregivers, have to play in mobilizing to meet particularly these 5 priority SDGs. Thank you.
Appreciate both kind of initial responses, and we'll get back to each of you with more specific questions. I like the term "measure what you treasure," and it did remind me that the health workforce strengthening kind of preceded, in some ways, social service workforce strengthening by maybe 5 to 7 or 8 years. I mean, they